healthcare system in the United States versus England. Main goals and priorities of the system. So in England, English residents get free public health care through National Health Service, which includes hospitals, physicians, and mental health care. Free health care was designed to eliminate unemployment, poverty, illness, and improve education. In the United States, it's a mix of public and private, for-profit and non-profit insurers and healthcare providers. Healthcare is seen as a privilege and not a right. Young people are covered under their parents until the age of 26, and that's if their parents have health insurance. How the health system and insurance scheme is organized. In England, public health insurance comes from general taxes and taxes paid by employers and employees. Private health insurance is offered by employers but can also be bought. Primary care is delivered through general practices who are gatekeepers for secondary care. Patients can choose which hospitals they want to visit, so you're not told you can only go here, you can only go there, you can go anywhere, and payments are directed to their provider. How the health system and insurance scheme is organized in the United States. United States has different insurance providers. Medicaid is universal health care for people who are 65 and older. Medicaid is state administered, means tested, and the eligibility varies by state and the low-income families. Children's health insurance program is for kids in low-income families who do not qualify for Medicaid but cannot afford private insurance. Private insurance is covered by employers if it is provided. Primary care physicians are in family medicine, general practice, internal medicine, pediatrics, and geriatrics. Outpatient specialists can work in private practices and hospitals and can choose which insurances they accept, and co-payments are paid at time of service or billed to their patients after. How universally the insurance system covers the intended groups. So in England, residents of England are entitled to NHS care along with non-residents with a European health insurance card. For non-European visitors or undocumented immigrants, only emergency room care and care for infectious diseases are free. Rights for those eligible for care include the right to care without discrimination and within certain time limits for categories such as emergencies and planned care. Hospital prescriptions are free. Dentist visits require co-payments unless you're low income, young, pregnant, student, etc. Vision tests are free for young people, low income, and those over 60. United States, we don't have universal health care, so only those who have insurance are covered. Each plan has its own amount of coverage, and insurance is different in every state. What conditions are covered and which are not. So as you can see, England has a lot of things covered, like maternity care, vaccinations, preventative services, some eye care, mental health care, palliative care, rehab, wheelchairs, hearing aids. Things that aren't covered is vision, if you can afford it, dental, if you can afford it, outpatient prescriptions unless you're young, low income, over 60, pregnant, or long-term condition or disability, travel vaccinations and certificates for insurance, and long-term care services like nursing homes. What conditions are covered and which are not in the United States. So each insurance has its own type of coverage. As you can see, Medicare has 3 parts. ACA, you get a lot of things covered, and that's more for employers with 50 or less employees. Medicaid covers a broad range of things. That's depending on the state, and states can offer physical therapy, dental, and vision. And as for Medicare, dental and vision is limited. Private health insurance benefits vary by the provider, but dental and vision are not always covered by the employer. And the uninsured have access to acute care under federal law that requires hospitals to treat those requiring emergency care. How the money for the insurance system is raised. So in England, money comes from general taxes and 20% comes from employers and employees. co-payments, and people using NHS services as private patients. So yes, their taxes are more, but they get universal health care. In the United States, patients usually pay full cost of care up to the deductible. Some plans cover primary care visits before deductibles met and only require co-payments. Out-of-pocket spending considerable for dental care and prescribed medications. Taxpayer dollars fund several programs for uninsured, low-income, and vulnerable patients. Who provides health insurance services and who pays them? So in England, primary care is provided by general practices. Most are private sectors, which means they're self-employed. Outpatient specialists are paid by government. Since hospitals are owned by the government, or foundations, so they have trusts which they can borrow from and invest in. In the United States, primary care physicians are paid through a number of things, such as negotiated fees from private insurance, capitation from public or private insurance, and administratively set fees from public insurance. An outpatient specialist's income depends if they work for a private practice or a hospital. What share of health costs are borne privately for those who are insured? So in England, 10.5% of the UK population had private voluntary health insurance at the beginning of 2015. And in 2016, voluntary private health insurance accounted for 30.3% of total expenditures in the UK. In America, private health insurance is accounted for 34% of total health expenditures in 2018, and private insurance is the primary health coverage for 67% of Americans. So I don't know about you, but I'm going to England.